it's easy to support Turning Point, and I think that's why it's been so successful. There is no ulterior motive in that center other than healthy, happy women, babies, and fathers. It's amazing. It truly is amazing what is accomplished there every single day. We love Turning Point. We think Turning Point's an absolutely incredible organization. Some of the things they've been able to do for our community, you could just not get in any other setting. First and foremost, they're not for profit. They are doing things for the right reasons, for all the right people. And when you look at the outcomes that they've helped create in the community, it is absolutely without question an incredible organization. I think the fact that they give education to women in crisis is incredible. And they give all education. It's not just a little bit of education. It's every option available to them. And on top of that, the education given to the fathers is unheard of. To be able to lend that much support and love and education to somebody who otherwise would really have nowhere else to go. And because of that, you look at the crisis pregnancies are actually decreasing in our region. Our prenatal care is increasing. NICU utilization is decreasing. And so you start to look at all of those things. We're having healthy babies by people who otherwise wouldn't have chosen to move forward with a pregnancy or wouldn't have chosen to move forward with the appropriate prenatal care. And when you look at those things, it's really, really, really neat. We're so grateful for Turning Point in our community. I've personally been giving donations for years since I very first found out about who they were and what they did. To be able to move forward the way that Turning Point does with a Christ-centered approach to doing the right things for anybody and everybody is amazing. I don't think we could be any better served by any other type of organization, more so than we are with Turning Point. Just amazing.
Every time I interact with Turning Point, I hear more of the stories of the clientele that come there and the outcomes that they have, the support that they offer. Not that they have any kind of pressure, but they approach each client from a love perspective, a need perspective, so that they first get to know the client. What are their fears, their anxieties? How can we support you and educate you so that whatever decision you're going to make regarding your pregnancy and your future, that it's going to be a decision that you will be able to look back on and know that you had enough knowledge to make a educated decision. And so the staff at Turning Point really just love their clients through these decisions, and then they expand their services, of course, to the fathers and have father classes and parenting classes, and they welcome not just the original client but their entire family members. So whatever questions are there for the clients, they are there to support and answer those questions and give the referrals to the necessary medical community and or community services. So they provide so much more than just an initial contact and counseling. They really are in it for the long term with their clients. So that's what I really appreciate about them.
I have the pleasure of working with Turning Point and having my students go out and spend time to learn more about the community and the services that Turning Point provides. Dr. Tony Levatino is a member of our faculty, and he was actually one of the founders of Turning Point. When he heard about the project and has gotten involved in the school, we decided it was a great way to get our students out into the community and to help them understand the real value that Turning Point offers to the community. Some of the students were very nervous about coming to Turning Point because they didn't know what to expect. They went online and they read about the mission and they read about all the things going on, but they didn't realize what a dynamic and warm place it is. Many of the students wrote in their reflective essays that they were really surprised that they didn't just support the pregnant women, but they also helped the whole family wrap their head around the idea of this new life coming in, but also just the straight, honest answers that they were able to give the patients, the reassurances, and even the connections to other doctors in town so that those patients could be really well cared for in every aspect of their life. Turning Point gives something back to the community that without it they wouldn't have. So many people, when they first find out about their pregnancy or are suspicious or just have questions, they really don't know where to go. And unfortunately, we know that the healthcare community and the status of healthcare in this community is all hinged on insurance, but not everybody has insurance. So Turning Point gives a unique link to good quality healthcare without any regard to insurance, uninsured. It's truly a community service.
I was asked to be involved with Turning Point about 2 years ago, and at first I will admit I was quite skeptical because I come from Albuquerque, and there are several pregnancy crisis centers in Albuquerque, and there's an awful lot of tension between pregnancy crisis centers and abortion clinics in Albuquerque. And I've had patients who have gone to the pregnancy crisis centers there and had had really poor experiences. A lot of fear tactics to try to keep their pregnancy, and then if they chose to keep their pregnancy, the unfortunate thing was they had no support then from this pregnancy crisis center in how to move forward in that. They didn't necessarily know how to navigate the system. It took them a long time to understand how to get prenatal care or even benefits and that sort of thing. So I was hesitant at first when I heard about Turning Point because I had that conception in my mind. And I thought that's not what I want my patients or the women of Las Cruces to have that experience. Once I went to Turning Point and actually saw the facility and started talking with people about their philosophy, about how they deal with women who are in the midst of trying to make this really tough decision, my mind changed an awful lot, because what I saw was a center that wasn't just focused around trying to get a woman to keep her pregnancy, but trying to actually help them to make a choice for themselves. Because quite frankly, parenting is permanent, adoption's permanent, and abortion's permanent. And it's a big decision, and it was more of trying to help a woman make a decision and then giving her the support to go through with that decision, whatever it may be. It's a very non-judgmental place for women to come and express their concerns and ask questions. And very importantly, especially being a gynecologist and concerned with public health, Turning Point actually would then help these women that chose to keep their pregnancy find prenatal care, find how to get insurance, find how to get involved with WIC and how to obtain diapers, then also parenting classes for the women, but also for the fathers. And so that makes a big impact in terms of the health of our community. It makes a big impact in terms of people not showing up to the emergency room with very dangerous medical conditions during pregnancy, having no prenatal care and just showing up. It makes our children healthier, and women that choose to keep their pregnancies, their babies are healthier because they've sought prenatal care because of this help. They've sought insurance because of this help. And that makes a really big impact on our public health in our community. It's a resource that we really can't afford to lose. There's not another pregnancy crisis center that I'm aware of anywhere that is like Turning Point. Giving women that support through not just making the decision, but then moving on from that is huge. We need these resources in our community to continue to help the women, children, men, and families of Las Cruces.